Are those quality assurance protocols and guidelines designed to reflect the standards of care in the communities where Small Smiles centers were located?
No. They were designed to address specific issues that we had identified as issues in some or a number of our centers. For example, on page 25, a guideline for the use of two different specific dental treatment codes that were being confused and sometimes applied inappropriately. That's not a quality of care issue, it's an accuracy of billing issue.
Okay, with the components of your quality assurance protocols that are clinical, such as when x-ray should be taken, procedural treatment guidelines, when parents should be allowed back with their kids, when patients should be referred, are those quality assurance protocols designed to reflect the standard of care in the communities where Small Smiles operated?
Objection.
No, they were designed to address specific issues that we had seen and had discussed with one of the larger third-party payers at the time, and working with them and working with the company, we came up with some basic guidelines for these specific issues that we felt needed to be dealt with.
Protocols that you wrote, Dr. Adair, start by saying the objective of these protocols and guidelines are to ensure that the highest standards of care are provided to patients?
That's what it says.
So they were intended to reflect the standard of care, weren't they?
I don't think the term used in that way means that these are standards of care.
Okay, what did you mean when you used the term standard of care in your own guidelines?
Well, what I meant was, for example, if you're extracting a primary tooth and you're using, there are two codes there depending on certain clinical circumstances. We gave directions and definitions of when each code is to be used. That's the standard we wanted them to follow. It's probably an unfortunate use of the term standards of care in that opening paragraph, but these are not standards of care. That particular issue would not be of any interest to, or much interest to any other dentists in the communities. They happen to address specific issues that we saw in our centers.